Can you see the screen?
Yes.
Shall I start?
Yeah, I think you can start.
Thank you to Malabar Angels, the entire investment team present here, and the Malabar Angels team for giving me this opportunity and the company this opportunity to pitch. So we are Pradhan Innovation Labs, and we are driven by innovation and powered by customers. This why the purpose statement has transformed into the logo where bulb is the innovation and the people are the customers. I'm the founder of the company, Krishnadas Ganapati. So before I go into the slides and the pitch, I would ask you 1 minute of your time. Uh, Imagine the present healthcare scenario. Do you know how many people don't have the ability to see the world as I or you do and enjoy due to cornea blindness? The question is, so is it 1,000, 10,000, or 100,000? No, it is actually 12 million lives don't have the vision like I or you do to see the world as it is. So can we solve their problems using artificial cornea and nanotechnology?
Excuse me, Mr. Krishnadas. Sorry to
Yeah.
interrupt you. Your slide is not moving.
No, no, I'm coming to the slides.
Okay,
Yes.
fine, got it.
Yeah. We are if you see artificial cornea, is it possible? Yes, it is possible. So do you know how many people suffer from 2 million needles pinching, which is chemotherapy for days and days? It is actually 95 million lives who go through chemotherapy treatment every year. And do you know how many lives in the polluted cities like Delhi, where every 1 in 5 child is asthmatic and COPD affected child? They cannot play like what any normal child can do, and they use the inhaler to solve their problems. You know how many lives? It is 700 million lives. Like in cities like Bangalore, Shanghai, Beijing, Mexico. And do you know how many flu infection cases are there in US every winter? 700,000 flu cases. It's a simple flu virus. So these kind of problems are what we are solving in our startup. So our vision is to innovate on 15 products that can change the world of healthcare. Our vision is to revolutionize the healthcare world for our 2 billion lives through nanotechnology. In short, making a better place to live for these 2 billion lives. In short, we want to create a US dollar 75 billion Fortune 500 company in 20 years using these 15 innovative products. So how we go about these products? So what are organs we should need to work on? Our key technologies are nanocoating, nanofiber, and medicated nanofiber, and we want to work on technologies like on organs, lungs, eye, brain, and heart. So what kind of product profile or product portfolio do you think we will have by 2031? Our roadmap is very clear for the next 6 years, and the first phase we'll be working on the lungs and the eye problem, and the next phase we'll work on the brain and heart problem, where we will be able to reverse mental disorders like schizophrenia, autism, uh, and so many dementia, and also chemotherapy-less cancer treatment. And some of the products like nasal air filter for pollution can make the life of a child who is in Delhi a very easy life to live. So these are the 15 products or 13 to 15 products which will make our company a US dollar 75 billion company. So our first product is an antimicrobial surgical N95, which is the world's first US FDA patent application with NIOSH approval. And this is a breakthrough and the best possible safety ever producible in the mask, and it has the ability to kill microbes on contact. And this will be going through all the regulatory approvals like CDSCO, CE, UKCA, and USFDA and NIOSH, making it the top 1% respirator in the world. The product has already reached MVP and is reaching the commercialization stage. And the trademark for the product, AirPro 3DD, which means breathe easy and be safe. 3DD means 3D shape and dual coating. So this has already been reached. So we are into commercialization stage. So whatever I talked about microbial infections like flu virus, we have tested on the top 4 microbes which cause respiratory issues like COVID-19. Then bacteria in Europe like Staphylococcus aureus, Disability pneumoniae, and TB bacterium. These 3 bacterium are already classified as Class A pathogens, where there is no kind of vaccines available. So this 99.9% of the COVID is getting killed in 5 minutes of contact, and 99.99% of staph pneumonia is getting killed in the contact time, and 99.9% of TB bacterium, which is the second solution in Asia to having a killing action on TB bacteria. So these are tested in advanced labs in Europe, Switzerland, and India. An Indian lab is ICMR approved official lab. So what are we seeing is a high safe efficacy device, which is offering the best possible safety performance wise. So is it biocompatibility or is it safe for human body to use? Which is a common question what we innovators face from medical professionals around the world. So we have done the test on Air Pro 3D face mask fabric, and the cytotoxicity was none. So the biocompatibility is very top notch, and it will be accepted by US FDA as the first nanocoating based face mask in the world. So how we have done or how we have progressed through breakthrough innovation and breakthrough results, which can change the world, is through the intellectual property. Our Indian patent has been granted for the face mask in June 2023, and we are filing the world's first nanocoating machine patent in India, US, Europe, and Japan. And we expect our patent portfolio to increase to 50 by 2030, making us one of the most innovative companies in the world. Do you think these kind of things are replicable? No, it's very difficult to replicate. If you have one competition, we have Respiracare, the rest are filtration masks, which are in the market. What is our vision and what we want to do with this device? So our vision is to create a world-class respirator, which is on par with 3M, Halyard, and Honeywell, offering the best possible safety and filtration performance, and which will be exported to around the world from Kerala. So ASTM level 3 wise, there is no mask in India which is compliant, and we will be one of the first masks in India to get compliant along with Halyard for ASTM level. So this is the competition analysis where we will be among the better of the competition, having no competition, and in the safety side, and we will be at a better position among the top 1% in the world. So regulatory approval wise, it's mandatory for medical devices. We do plan to cater to Indian approvals, Europe, UK, and the US FDA and NIOSH approvals, which will be completed by June 2025. For clinical trials, we are getting help from ICMR Technical Advisory Body to get clinical trial support from the ICMR approved clinical trial facility in Kerala. So our sales cycle should start provisionally with the Europe and the UK approval. So these kind of innovative devices, does it have a kind of a big market to make it a big device by revenue? Yes, as per Gartner study, the face mask market is growing at CAGR at 25%, and we want to have a 25% of the US dollar 20 billion market and a leader in the face mask market in 15 years time. And this product alone, along with the 15 products, each will make us a $75 billion company in 20-30 years. So that's the vision we have for the country and the state. And I hope, and we are committed to that vision to make the vision possible for the future generations. When it comes to revenue model, where we revenue of the sales model, our 75% of the is coming through sales, and 25% is through licensing to companies when the demand improves for our antimicrobial face mask. And we'll be among the best in the world with all the regulatory approvals. And we make 66 paisa for every 1 rupee of mask sold. And our product are value pricing and are more affordable to customers, offering the best in safety and quality to the customers on par with the best. So all these revenue model and innovation, the patent, intellectual capital, product portfolio. So what's the traction? What are the customer acceptance in the market? So we have interacted with top hospitals like Apollo, Max, KIMS, Kaveri. Then we have two hospitals like Amrita. Then VF Lakeshore and other hospitals who are very bullish about this breakthrough device which can transform the healthcare industry. And they have particular value proposition like head look should not break, it should have good fit, should have good quality, and should be breathable. That has been understood, and this is part of our value proposition that we are offering to the customers. And they are ready to replace the corporate products with our face mask, the antimicrobial face mask, which will be NIOSH approved. So our we have around 80,000 masks being sold in the pilot lot, and the churn is less than 5%. And our B2B customers, we don't have any churn, and all the B2B customers and B2C customers are having repeat orders. And we have a CAC of 5% of lifetime value, where I personally and sales team personally interact with the microbiologists, top doctors, and the CEO, and help them transform the healthcare infrastructure. So during COVID and the Nipah crisis, we worked with the top hospitals in Kozhikode and in Trivandrum and in Kerala. So we had a big appreciation letter for the quality and the performance and safety that the mask offered to the doctors. And we are being appreciated by around the world for the technology that we have developed. When it comes to the go-to-market strategy, which is a big make or break for any startup, we are only working with those hospitals which are demanding advanced infection control, and we are appointing distributors and evangelists who will spread the word and create awareness and create interest and curiosity among the doctors and the healthcare workers and the customers around the world about this technology, which can change their lives. So go-to-market strategies is to work with the hospitals which have a clear vision ahead in infection control, and that is 80% of the hospitals around the world. So our vision is to export from in Kerala to 100 countries like Europe, United States, Africa, Southeast Asia. And these are our vision for all the 50 products is to have 80% revenue coming from global markets outside India and 20% for domestic market. So these kind of technologies require license approval, and we are in the process of acquiring them. When it comes to the sales, we have done 1.5 million rupees sales in the last financial year. We expect to match this year. And our startup will scale up to 100 crores or by revenue, and close to 500 700 crores by value in 5 to 6 years, making it was one of the most fastest growing startups in India. And we are completely bootstrapped without any debt or grant. And we expect to grow much faster later also with the few product pipeline that we have. My ask for this innovative breakthrough and futuristic startup which can change the world of healthcare is for 3 crores against 50% stake, making us a pre-money valuation of 20 crore and a post-money of 23 crores. In 5 years or 6 years, the value of the company will increase to, and we are committed to that value of close to 500 to 700 crores, making you have a good return. Before I go into the team profile and what background I have in developing these products, I would like a half minute to tell me the vision behind starting this company and coming to Kerala. I was a son of Kerala. I was a Keralite all around for 22 years when I studied here. I came back with a vision in mind to make Kerala the most promising medical devices location in the world, and most attractive location in the world. So I am one among you, or one among the Keralites, and I am your son. So as the saying goes, road does end, or say you can say love and relationship do end, life does end, or anything which is present in the earth does end. But our dream and vision never ends, never ends, and never ends, and it goes on and on. Our dream and vision is to be known as a global MNC from Kerala and have a revenue of US $75 billion in 15, 20 years. that is why I came back to the state and make the state proud and its people proud. I hope as a partner, as an investor, you would partner me in realizing this vision for the state and for the world, and would come along in making the healthcare world a better place. So coming on to the team profile, I am 22 years experience in automotive, aerospace, and nanotechnology. I worked in corporate like Tata Group, where I spent 3 years in TML and 2 years in TML subsidiary. Maruti Suzuki 8 years, Mahindra short stay, Godrej Aerospace 4 years, and Hetic India 2 years. If you see any aircraft A320 flying around the world, including Indigo, has a contribution in the rear fuselage. 50% is developed by my team. Then in any Boeing Dreamliner or any Chandrayaan or Mangalyaan mission or any of the Maruti's new cars or Tata's trucks or cars or Mahindra's cars, I have direct contribution from my team under my leadership. So I have the credibility and the backup and potential to pull off this venture into a big company. And I have international exposure to US, Europe, and Japan, where I work with multiple multinational people, cross-cultural people. My other partner is engineering college classmate who was an early investment. He has 40% equity and he has experience of 22 years in SAP, ERP, and development. And he bankrolled initially the project to take off. And we were incorporated in September 2021, and we shifted to Kerala for the higher opportunities that the state offers through Kerala Startup Mission and Startup India. Our mentor is a NanoVision Group member, which is the elite group in India for nanotechnology, and he's among the top 7 nanotechnology scientists and entrepreneurs in India. His name is Mr. Punit Mahatra, and he guides us in the product development and in the scalability. As I said, dream go on and vision goes on. I request each one of you to participate in this visionary and innovative company and make our startup and make the state proud and successful. I thank you for your valuable time and your patience. I look forward to questions and split for the investment is in the annexure side. Thank you very much, and I appreciate your time, and I really respect your valuable your inputs. Thank you.
Mr. Krishnadas, there is one question in the chat box. I think you can take up in the meantime.
Okay. Would the revenue model be better off in the reverse ratio? I would say these kind of innovative devices are generally marketed in the if you want to develop competitors for your product and not kind of develop your own product to change the world, you expect to get wiped off. So once we have a generate the demand for our own product, which should happen very fast, we are ready to license so that most of the manufacturers will come on board. Initially, we would like to, the idea is to have a antimicrobial mask from our own portfolio first and then licensing. We are open to licensing with companies like 3M Honeywell. It is impossible to reach so many customers with our company alone. So being a big problem, we are solving. Any more questions?
Anyone has any questions, please, you can put it in the chat box or you can ask.
Yeah, I have one question.
Yes, sir.
Prasad here.
Yes, sir.
Just in terms of your today, what is the product that you have now? Just one N95 mask? Is that what you are right now having taking to the market?
Yes, sir. N95 antimicrobial face mask.
That's the one product that you have. And how much is the revenue that is generating for you currently?
Currently, we have two B2B customers getting paid customers and around 100 consumers who use our mask during infections. And we are using outsourced facility, so we cannot scale up. So we want to build our own facility to have a big volume market. And we have approached more than 25 big hospital groups in India. They are willing to take with some kind of certification and value proposition.
You're talking because the scale up that you're showing is quite substantial, and I'm looking at the futuristic approach. But in terms of the goal, if you go on a step to step, you talked about lungs and as well as the cornea also you are referring
Yes.
to. Is
Yes.
there any product in that space currently?
That is all in the design stage, and it will be going to prototype stage next year, and regulatory approvals will be made.
Okay.
These are innovative, revolutionary technologies which can change a lot of lives, and it has to go through US FDA, then clinical trials, and we are looking at a span of 2 to 3 years for each product to get developed. We can easily scale up to the 3-ply and 4-ply and scrubs, because the nanocoating machine that we have developed is capable of producing any mask. So 3-ply, 4-ply, we are entering production next month. 3-ply, 4-ply.
But you are already present internationally, or are you?
No, we have presented in across multiple platforms like Thailand, Germany, then Italy, US also. So we get quite appreciation for the work we do, and we are in touch with the multiple agencies in Vietnam, Taiwan for licensing our product, and it's medical license, and placing the product there.
Okay, but right now there is no revenue coming from internationally.
No, revenue wise, no. Because regulatory approval will be done by June, then we'll start exporting from it.
Okay. Thank you.
Yes, thank you.
Hi, Krishnadas. Shivakumar here.
Yes, sir. Hi, sir.
Congrats on your audacious goal. Just trying to understand, do you have your projection for the next 5 years, and also how are you planning to utilize these funds? You're asking for 3.5 crores for 15%, if I guess.
Yes, sir. Yes, sir.
And how are you planning to?
So this is the utilization. We want to build a facility in Trivandrum and Kinfra using world-class machines, and including documentation and test of FDA and NIOSH test in US. It all comes to 2.1 CR plus 90 lakhs for working capital and other expenses. This is the breakup, sir. I put it in annexure because it will look odd in the ask slide. So basically, we are trying to purchase mask making machine, which will we supply to 3M and have the same machine. Then quality testing machine, fit tester from Japan. Then we are creating a dust-free room for in Trivandrum and Mulera. And then we are doing the FDA 510K and NIOSH test in US, Nelson Lab, which is the best lab in the world. And FDA 10K and documentation to fire, and then some other extra costs. So that is the funds that we are looking at deploying here.
And the projection for at least 3 to 5 years?
So I will come to the projection. Yeah, projection we are looking at 3 years is 35 CR. So that's what we want to reach revenue. I have a substantial backup to tell this, because Apollo Hospital with around 28 hospitals alone is a 3 crore plus customer, Apollo Group alone. And Kaveri also is equivalent to 4 to 5 crores. So these two customers, hospitals put together as are 8 crores plus. And they are all ready to take our mask and replace their corporate mask with, provided we get through regulatory approvals of NIOSH and have the value proposition that what I've told. So in India alone, with the face mask demand is consumer side is very less, but hospitals don't take any risk with patients in respiratory problems. So Apollo and Kaveri put together itself is 8 CR, and other mask providers in other countries, we can scale up very fast. because the evidence is clear. The evidence is tested and clear, and we have regulatory approvals of NIOSH, which is the world's gold standard. So basically, we are seeing no competition and offering the best in the of best. So I expect to
This
scale up
projection
to-
is basically using this mask only, right?
no mask and other devices alone, other devices put together. Mask itself, we want to be at least 5 billion USD in 15 years. Mask alone.
No, let's
3 years. 3 years we want to
let's
reach.
take a 3 to 5 year window range, which is
Yes, okay.
digestible for us.
Yeah, so 3 to 5 years, 5 years we are looking at 100 crores with 2-3 products.
Can you tell which other two products you are?
3-ply surgical sterile 3-ply 4-ply and scrubs and artificial cornea.
Have you?
These are 4 products.
But
Hello?
this will easily take a new product, especially something like an artificial cornea. It is easily going to take a lot of time to get tested and approved, right? Because it's not like a surgical mask where you can get an approval. It goes into a person, right? So it will be much more complex, especially if you're looking for an FDA or something, right?
Yes, sir. We are looking at 3 years for breakthrough devices which are in vitro, in vivo, inside. We are looking at 3 to 4 years pipeline timelines.
So the revenue for those two devices will not be coming in the next 3 years, right?
Yes, sir.
So that means you're left with only one product, which is the mask.
No, so mask itself, 2 varieties and 1 scrub, which is like a replacement for gowns. So these are PPEs and external in vitro. So we can get approval in 1 year's time.
Okay. How much is your team size right now?
We have a team of 7 people now, which is 2 in quality, 3 in production planning, and 2 in production, 1 in production, 2 in production. And we expect to increase to, once the production starts, 30 to 40, 30 people will be enough. And the production facility with the 3.5 crores investment can cater up to production of 40 crores revenue. The capacity of the machine is that.
So who is doing this research or development of these products? Because the products that you're talking about are highly sophisticated, technology intensive, domain intensive, right? So who is in charge of those products? Like, say you're talking about artificial cornea.
Yes.
So who is in charge of developing that?
R&D is headed by me, and we plan right now. The entire R&D for face mask was done by me and some few workmen, and these people are taking the quality, implementing the quality systems, the present manpower, and productionizing it. So the R&D, everything was done by me as an innovator alone, along with my engineering college classmate.
You're talking about like three or four products in a span of 3 to 5 years, right? So
Yes, sir.
who will be in charge of all these things? You will be in charge of all.
Yeah,
this?
I'll be heading the R&D, and sales will be looking after by key member who's having the sales and marketing will be done by separate person. But operating role and R&D will be done by.
Okay.
I cannot do all things alone. So we are planning to employ a senior role in marketing and sales.
Okay. Yeah, understood.
Yeah.
That's all from my side.
Mr. Krishnadas?
Yes, sir.
Yes, good evening. Dr. Kurian Thomas here.
Yes, sir.
I'll
How are
be-
you? I remember you.
So my question is a kind of a continuation. So you said
Yes.
that the R&D is being done by you and your colleague. But
Yes, sir.
no, so the testing of the mask and other things, it has to be done in a hospital setting and along with the patients. So
Yes,
that
sir.
will be different from the development of the technical matter, right? For
Yes,
the
sir.
development of mask per se. So, what's your experience in developing such a medical device and testing and launching it? Because to interact with the doctors and the healthcare setup, the mask is one thing, and like sir mentioned, this testing for the cornea and other things that require elevated level of things.
Yes.
May I know your, have you had an experience in this field testing and medical device testing in the past?
Yeah, my experience may not be from medical device testing, but the last 3 years I have been trained by several doctors and medical professionals and nanotechnology specialists who has helped me learn these things. And lot of things was picked out through courses. And as a technology person who is solving healthcare issues, I am good at it. But if you see medical professional wise, we
Yeah.
do plan to have an advisory board having hospital own CEOs and doctors in the next year. So the doctors board will be in place by within next year. So that wise, no medical device company can produce a world class device without doctors board. So that is this.
Yeah. So my question is the same only. So you can just tell the mask is already in place, and the you
Hello.
have not shown in your presentation the prototype that personnel is going to wear, right?
Yes, sir.
So because the no longer being used so frequently. Now, maybe like in the past, people are using it in intensive care units and operation theaters only. Compared to the time of COVID, when all the healthcare professionals were using these masks, that
Yes.
the usage is not so prevalent. So,
Yes.
can you tell me? So, we had discussed about the way in which you are going to test and show that your product is the use case of your product, how you are going to prove it. Can you tell me how you are going to achieve that with your mask and your scrub device both?
Yes, sir. So we are having actually meeting with ICMR top advocacy team tomorrow, and they are given provisional go ahead for using the intent profile to do the clinical trials and formulate the total this one and get ethics approval and other approvals from the body. So I had contacted ICMR through MedTech Mitra, so they had fast track my application, and we have meeting with ICMR top team tomorrow, and they are ready to help us in doing the HTA and clinical trials and they're ready to give the funds also to the hospitals to do the trials. Basically, this is an infection control device and not a mask device. If you see any hospital around the world, they will be having a heavy load of microbes. Even in ICU, with all the vacuum and the clean air systems, there will be sufficient load of microbes. So if you see, if you use a normal filtration mask, there will be no change of load. If you use our filtration, if you use our antimicrobial mask, there will be a change of load of 99.9%. So we are working with a 0.1% load, which cannot cause any infection to the patients who are in the ICU or secondary infections. So product wise, agree mask usage is very less. I agree because the infection control post COVID need to be more advanced and with more pandemics like bird flu and so many other things coming up. So we pushing it with the hospital as an advanced infection control device, not as a face mask or the N95 mask. The N95 mask is a filtration device where the microbe is alive. So our proposition is for the clinical trials also is to prove in clinical conditions. I would say the only way to test is through RT-PCR. So RT-PCR or any kind of a test to counter the dead bacteria. So like CFU or something like that. That kind of a thing that we are trying to work with ICMR and the hospitals.
So the thing is, when you are meeting with the ICMR team, you are going to pitch your the 3-ply mask with nano coating to say that it will have efficient infection control. When you
Yes.
use the mask, there is a chance that you won't get infected if you come near a patient. That's
Yeah.
it. So what is the study like the protocol that you are proposing to the ICMR people? They are not going to suggest a protocol to you.
Yes.
You are going to go to them with a plan. So
Yes,
tomorrow
sir.
when you are meeting them with the nanoparticle that you have integrated into your mask, you are saying
Yes, sir.
that this will help prevent the person wearing the mask from getting infected.
And the other person in the nearby getting infected. Both.
No.
Me.
See, the one person is infected. You are like, I am a doctor. If
Yes.
I am moving around in a hospital, there
Yes.
are other people who are infected. You are saying that if I use your mask, I will not
Yes.
get infected by these patients because I am wearing a mask with a nanoparticle in it. Correct?
Yes, sir. Yes, sir.
So, what is how are you going to test it? The ICMR you are meeting tomorrow. What is the
Yes, sir.
protocol that you are going to tell them?
The protocol is we have to first ask the patient to wear. Patient to wear. There will be comparison study. Okay, sir. Ask the patient to wear, and I would say I researched with a lot of top doctors. They are saying it's a little bit tricky, saying that we have to count, check using RT-PCR in the environment where it is available. Take the air and check. That's what the doctors are trying to suggest us, saying that this can be done only through RT-PCR. So RT-PCR can only done on any device which is having an either dead microbe or a live microbe. So the thing is that the patient has to wear the mask, and these procedures will be normal like any patient will be. The thing is to check whether the microbe is dead or not as per lab trials in clinical conditions. That's what we are trying to check. The environment where the microbe is being present in the hospitals, whether it is alive or dead. That's what we are trying to check. Hello.
You are doing the pilot study protocol and
Yes,
the
sir.
guideline that you are going to test it with, because you have initial contact you have established with the Apollo group of hospitals and all. So
Yes,
in the
sir.
hospital, what you are going to test? Do you have a study protocol with you?
The study protocol, we have formulated the study protocol. Actually, Narayana Hridayalaya already done one of the scrub with antimicrobial for one other startup, antimicrobial scrubs. So they are ready to help with us with the protocol. So they already done one similar study with the scrubs. So they will do a similar study with the face mask.
With your device?
Yes,
The
sir.
scrub.
No. Scrub is for other company, other company, Thermasense. They are the only fabric company. They don't produce medical device as such. They produce antimicrobial fabrics.
So with the scrub testing that was done in Narayana Hridayalaya, what
Yeah.
did they test? Did they test RT-PCR? Did they test?
RT-PCR, sir.
So RT-PCR where?
In the hospital critical conditions, they did the RT-PCR, and the same protocol we are extending it to us.
So the RT-PCR was done in the hospital air or in the patient's sputum, where it was tested?
That's a patient sputum is any patient with infection will have continuous load of microbes. So whenever you test it, RT-PCR will be positive. So we can't do that. We have to.
No. I am not asking about what can be done and all. I am asking what was done and what is your plan to test it. I am not
Sir.
asking about the possibilities. And my question is very clear.
Yes,
You have a
yes. Hello.
product, and
Yes,
this
sir.
is a product. No,
Yes, sir.
there are a lot of ethical considerations. I understood that. I
Yes,
just
sir.
want to know, number one, in Narayana Hridayalaya, if it was tested, what was the test that they did? Number
Yes.
two, if your product, to prove that it is efficacious, how are you going to test it?
What they have done is they have done the RT-PCR before using the product and after the product. Before the product
RT-PCR where? RT-PCR where? In the air.
in the air, yes, environment. They collected the air and they checked the samples, CFU samples. CFU.
So in the air, they have tested for presence of bacteria.
Bacteria.
And and when did they test the air again?
In the gap of 2 hours. 2 hours. Every 2 hours, they used to take sample and check for RT-PCR. And in the study was published also found out that antimicrobial activities was present in that scrub.
So you are saying that in the hospital, in a
Yes.
room, they have tested the air, and the
Yes, sir.
people have wore that scrub.
The nurses and the doctors and the patients were using the same scrub. The entire ICU was using the same scrub.
No, sir, my question is, in Narayana Hrudayalaya, did the test, what's the test done using a scrub with a nanoparticle?
No, it is different technology.
Okay, so then why should see, you are testing the air for bacteria. After putting the scrub, you are testing the air again every 2 hours. How
Yes, sir.
how will it differ?
Sir, the scrub is antimicrobial, sir. So the moment
No,
you are
that was
breathing-
only fabric you said, right? The other
Yeah,
companies, one is
fabric only. The fabric they used in to make the scrub was antimicrobial.
okay. So you are saying that because the people are wearing scrubs which have antimicrobial activity, the air around them became free of bacteria.
Yes, sir.
That is unbelievable.
No, sir. They have published the report, sir. I can share.
You please you should please share. So
Uh,
see,
no, sir. This is
And
antimicrobial. Yeah.
and also see, no, my
I will
if
share the
you are-
protocol also, sir. I'll
Yeah.
take their permission and share the
Yeah.
protocol with you.
What about your protocol? You are
We'll be-
also see if you are the
we are
mask.
That's the scrub,
know-
and we have the face mask. So same protocol.
So
will be
in
used.
your case, what you are saying is that the face mask that you are producing, the
Yeah.
doctors are going to wear that mask,
Yeah.
and because they are wearing the mask in the room, the bacteria that is present will die because the mask is being used.
No, bacteria is not bacteria present in the air will not die because of the face mask. With the breath, the bacteria is going to come and sit on the mask, sir.
You are testing the air only, right?
So that is what air has a microbe load. Okay, sir. My air has a microbe load. Say suppose
Okay.
100 bacteria. And with the breath, with the, you taking breathe in, breathe out, that air is going to come inside and carry the bacteria onto the mask.
Okay.
Okay. And the mask, the moment it sits on the mask, it is dead.
Okay.
As per lab trials that we have done. Okay.
Okay.
So what the lab trials, what we have done is that we have given the fabric to them, and we are used in the face mask, and they have put a huge load of microbe and counted using RT-PCR how much is alive after the contact time.
No, I know. Again, we are going in a reverse direction.
No,
I am
no, sir.
asking how you are going to test your mask. That is all the only my
Sir,
question.
that's
is.
what I'm saying. The air or the environment in the hospital or the ICUs are not stagnant airs. Either they go
Okay.
in through the HEPA filter and go outside, or it
Okay.
goes through the breath of the people who are sitting in that in the ICUs, like nurses or doctors or patients.
Okay.
Yes, sir.
Yes.
Okay, sir. So now you believe, right? So 70% of the air it goes through HEPA filter, and HEPA filter throws the microbes load onto the environment outside the hospital ICU. That is how
Okay.
they try to make ICU clean. So that's a clean room, like a clean room. So the rest of the load will be going through the air, through the breath of the people who are there, sit onto the mask, and that load is vertically barely zero for every breath they take.
Okay.
If they have 100 CFU, it will become zero in 5 seconds of contact. So that zero CFU goes on to the environment. It is zero CFU. Okay, sir.
Okay.
So that same CFU, it circulates. It cannot do any harm to the patients or doctors.
Okay. So again, so you are going to test. So what the ICMR people? What are you going to test? The air, the colony forming unit (CFU)
Yes,
of
sir.
the bacteria percentage. Is it what you are going to
Yes,
test?
sir. Yes, sir. Yes, sir. Virus and bacteria both. TB, basically
And,
TB bacteria.
TB bacteria.
Yeah, TB bacteria.
TB bacteria in the air you are going to test with the PCR.
Yes, sir.
And then, so you will
Sir,
test.
in fact, what I will do is that I'll take a personal email ID and I'll share the entire protocol from their permission. They are done with Thermosan. So maybe your clarification.
No, I am interested in your protocol, not
We are
one
following
that
the
was
same
published.
protocol what they have done for Thermosens. Only difference is the device. They
Okay.
use the fabric as a scrub. Now we are using our face mask.
Okay. So, you can send me the protocol for all the people who are listening in on the meeting, and for your information, I will tell something. You can correct me if I am wrong. Number
sir.
one, even if one bacteria is present in the air,
Yes,
the
sir.
PCR is a technique which amplifies or increases the number of bacteria so that it can be detected. It does
Yes,
not
sir.
PCR for polymerase chain reaction does not detect the number of bacteria in the air. Number
Yes,
two,
sir.
colony forming unit is something that is got by culture. So
Yes,
when you
sir.
are doing PCR, colony forming unit is not the appropriate term to understand what percentage of bacteria is present in the
Yes, sir.
environment. Number three, if you the PCR testing takes time. So if you take a sample of air and you
Yes,
test it again every 2 hours to do PCR testing is time-wise and economically it is not feasible. Number four,
sir.
mycobacteria presence in the ICU air, if it is detected, as by per protocol, that ICU cannot function. We frequently screen ICU's air for
Sir,
presence of staphylococcus, mycobacteria, some pathogens. If these pathogens are present, that ICU will be closed for sterilization and then only it will restart. So keeping in these
sir,
points,
how the secondary transmission happens from hospital, sir? You please, if I don't want to deny you your question,
Yeah.
but secondary
Yeah.
transmission do hospital have in hospitals, and hospital are the only source for secondary airborne spread from, because that's the first patient's visit. Doctor and the hospital are the secondary transmission issues. The antimicrobial load AMR we can say is from the hospital. See, I recently studied from a big study in US saying that the hospital is the source of the AMR. This one. So if the microbial load was found out that that's a zero in the hospital ICU, then how come people get secondary infections from hospitals?
I never said that hospital microbial infection is found as zero. I said that we tested for staphylococcus and mycobacterium, tuberculosis.
Yes,
You
sir.
mentioned that you are.
Yes, sir.
So these organisms, if it is present, if they are found, then they close the ICUs for sterilization and then reopen it again. So
Yes, sir.
what I meant to say is that the fact that we are going to achieve sterilization of the ICU air, about whatever is left after the HEPA filter clears out, with the
Yes,
use
sir.
of mask and scrub containing nanoparticles. So the testing the air in the beginning and after some time, and so saying that we are using the mask because of that hospital air will become sterilized is far-fetched is what I felt. If you say that
Okay, sir.
because a person is wearing your mask, if he does not get infected, then that can
Yes,
be
sir.
understood. The air which is present outside the patient gets sterilized because the...
No, sir. What I meant to say was the air you take in ICU is a self-contained area and it's inside air only. And the moment the microbe is going to come and sit on the contact of the face mask, it is dead. We are done using lab trials. Huge load when compared to hospitals.
Yeah. Okay. Thank you. Thank you. That was my doubt.
Hear me?
Yes, sir. Have any doubts, sir?
Yeah, I'm in a public place, so just bear with me. Now,
Yes, sir. Please,
I'm
please.
just, so I think the long discussion that you and Dr. Kurian had,
Yes, sir.
none of us except Dr. Kurian in this call are really medical experts.
Yes, sir.
So you might like to have a separate call with him, and we
Yes,
would
sir. I will.
go, no, let me complete. We would certainly
Yes, sir.
go by what he is assessing
Yes, sir.
in terms of the suitability or relevance of this product
Yes,
in the very short term. See, in medium term and long term, every product is relevant.
yes,
But as an investor, we probably are looking at the relevance and utility of such products in the short term, right?
yes, sir. Yes, sir.
So I think we can arrange a separate call and subject to Dr. Kurian's time, etc. We'll figure that.
Yes.
But let me add on to what he and Shivakumar said. I think your plans, I'm just reminded of Barack Obama's book, Audacity of Hope, right? So
Yes,
if you
sir.
decouple, I mean, with no disrespect meant to your courage in starting this company,
Yes.
in coming back to Kerala, etc.
Yes.
I mean, if you decouple the products, like what they were talking, I mean, some of the other members talked about cornea testing and all that. If you just focus on mass, what's the kind of realistic business plan one can look at?
Yes.
Let's say between today, that is 24, 25, and say 26, 27. What's the number you will achieve, let's say in 26, 27, purely based on mass, which is the only
Yes.
product you now have, and
Yes, sir.
perhaps do not require too much of additional investment, except
sir.
for those regulatory clearances in US and
Yes.
Europe, which of course will
Yes.
cost you substantial amount and timeline. But let's say we focus just on the current product, which is the mass, right?
Yes, sir.
And since you said that you are going to focus on B2B and not certainly not on B2C,
Yes.
how many hospitals will give you business in the next 2-3 years? And what would be your revenue only based on mass in say 26, 27?
So 26, 27, we are looking to onboard Apollo, Kaveri, and major top 10 hospitals in India as a customers. And that customer base can 26, 27 can lead to 16 to 18 crores in revenue.
No, we would like to get little more data because we don't
I can
have time
share, sir.
now.
I can
Yeah,
share.
yeah,
I can mail. I can mail you on
yeah,
that.
we want the assumptions that make up this 16 crores. Okay.
Yes, sir. Yes,
In
sir.
terms of number of hospitals, in terms of how much each hospital, let's say Apollo, Kaveri, how much they will buy, what
Yes,
else
sir.
they will buy to, let's say meet the same requirement. I mean, they won't just depend on your product, right?
Yes, sir.
Or let's say this type of serving the anti-infection requirement, they may have other
Yes, sir.
choices as well.
Yes, sir.
So I think we need to understand how this company is being built, and that's our problem always with founders. Okay,
Yes,
I mean
sir.
you may be good in product, but we don't know how the business is being built. So
Yes, sir.
we would perhaps now like to know little more about how the business is going to be built only on the first product. Because other products, I mean, you have to, like I think Prasad or Shivakumar asked, we don't see the R&D capability beyond both of you. And even
Yes,
in
sir.
both, even in two of you, I think the problem is you are not showing the medical experience, right? Because
Okay,
you
sir. I'll try to learn,
no,
sir.
you said one minute. You said you have come from automotive background. The
Yes,
other gentleman is from ERP background. So we are
Yes.
not seeing that medical background. And hospital selling to hospitals is a different ball game, right?
Yes, sir.
I have seen my own money getting sunk in 3 or 4 medical devices company which have very high technology, but they don't know how to sell. They did not know how to sell. They
Yes,
did not know the distribution dynamics. They didn't
Yes,
know
sir.
the hospital decision-making dynamics.
Yes,
So
sir.
I mean, that's, I think is a very, very critical gap in the team. And somebody asked, I think in the preliminary assessment I was going through, that where is the medical expertise in this team, right? Is there a doctor? Of course, you replied just 5 minutes back that you're going to get some people on board next year.
Yes, sir. Yes,
But,
sir. Yes, sir.
but I think selling to medical use cases in India, especially. Okay, maybe abroad it's easier, but abroad you have a different challenge in terms of getting FDAC approvals, etc. But in India, I think the decision making is very, very complex. Okay, so I think the way I see it as a pure play investor, I think you really have to show a lot of medical related domain capabilities, both in R&D as well as in selling to decision makers in small, large hospitals. And of course, de-risking from an investor perspective, right? De-risking the business from the long-term products. I mean, the long-term products may have great value and hopefully it will help you to build a big business. But right now, as investor, I think most investors will be focused on the next 2 years in terms of how you will build the business, which is really centered around one product, which is the mask, right? So sorry for this long dialogue, but I think that's the way I think investors would look at it.
Yes, sir. Basically, the 16 crores, we are in touch with around 5 to 6 distributors who are having close contacts with the purchase officials and the senior officials over there, and they are ready to establish our market for us. And these are distributors, are top distributors in India, and they have worked with hospitals like KIMS. Then they have worked with Amrita. They have worked with Apollo. They have worked with the Kaveri. They already have a product pipeline being placed in these hospitals, and our product is being pushed as additional as a breakthrough device, as a NEOSH and an FDA approved device, as India's first and world's first. So, last 1 year, personally, I have traveled throughout India meeting microbiologists, top doctors. They all have the same opinion, saying that it's a breakthrough device just by the lab reports alone. So, and these are done in advanced labs in Europe, so it's genuine. And any solution which can kill microbe, if you see Staphylococcus and TB bacterium, there is no vaccine. With efficacy also, efficient vaccine also in the place, and we have tested on actual microbes in Europe. So our count is 99.999%. So that is what a vaccine does inside the body. So breakthrough wise, sales wise, I agree. I may not be the right person to do the sales. So we are appointing top distributors who are willing to place our products.
Okay, what I feel is as a summary of this discussion, number one, we'll arrange a discussion between you and Dr. Kurian so that he can assess the technical questions
Yes.
that he was asking you in terms of how these were tested in Narayana Hrudayalaya, the protocol, all of that, right? So maybe we'll have a better view after you discuss with him in
Yes.
terms of how the tests have been done. And
Yes.
number two, you can show us a business plan for next 2-3
Yes.
years, maybe 2 years,
Yes.
based on this one product, right?
Yes, sir.
And with all kind of assumptions as to how you'll really spend money on R&D, if the products have to be refined. I'm hoping that you've got all Indian regulatory clearances, right? You got a
Yes, yes.
CDSO approval?
CDSCO is done next month. It is under
Okay.
process.
Yeah. Are you able to leverage a KMTC in any way?
KMTC are helping us with the factory location and factory approvals, but they are don't have any contact with the hospitals. But distributors, the top distributors have direct working relationship with them, so the trust factor is there.
No, I'm sure KMTC has a lot of influence today in Kerala.
Yes, sir.
I think you must.
KMTC. Yes, sir.
Have you met
Please.
Mr. Padma Kumar?
No, sir, I met Rajesh sir. Rajesh sir is helping me find factory location and factory space. And
No, that's not the manufacturing. I'm just talking about the overall policy making, the customer acceptability. You know, how to accelerate customer acceptability, at least in Kerala, right?
yes,
I mean, I would be happy if you say next year I'll do 10 crores, come what may, from Kerala hospitals. Are you in a position to say that?
yes, sir. Yes.
So I think you must look at leveraging KMTC. Maybe you should go and meet Mr. Padma Kumar. You know him, right? You would have heard of him.
Yes, I met him once. Sir.
Yeah, he himself was a medical device entrepreneur. So you should go
Yes.
and meet him. He can
Pen Paul.
tell you, yeah, he can tell you a lesson or two in terms of how to build a business.
Yes.
So I think you should leverage KMTC. But coming back to my point number two, I think you should look at showing us a business plan with all kinds of assumptions,
Yes,
from
sir.
the R&D side, from the distribution side, from the let's say pilot side, testing side, all of that, right? State-wise, geo-wise within India,
Yes,
right? You have to tell us, you know, how do you get this X crores, whatever is that X crores,
yes, sir.
in 2 years, right? Because
Yes.
that will give some confidence
Yes,
that a business can be built initially, at least on one product. And with that confidence which you will generate when you are building that one portion of the business, you will probably get into the other product ranges as well,
yes,
right? So you can get back to us on these 2 points.
yes, sir. Yes, sir. Please, I'll give me around 1
Actually,
week's
you
time.
are in Kochi, right? Maybe we can, if Dr. Kurian has time, he can even meet you face to face. If he has already
Yes, sir. I'm in Trivandrum. I'll come to Kochi to meet Kurian, sir. I'm a big fan of Kurian, sir. So
Yeah. So maybe subject to his time, you can actually meet him face to
yeah,
face.
yes, sir. Yes, sir. I can meet you. No
Yeah.
problem.
Okay. Okay. Anything else from anybody else? Otherwise, we can conclude here. Fine. You can exit, Krishnadas, and we'll have a small internal discussion, and then we'll get back to you with the
Okay, sir.
points. Okay.
Thank you, sir.
Tomorrow.
Thank
Thank
you.
you.